Chapter 17 hits on rest, sleep, and pain. And we talked about pain in Chapter 12, so you should be very familiar with the pain assessment process. The main point that I want you to walk away with for Chapter 17 is that rest and sleep is essential. We talked about in Chapter 2 how it's a part of Maslow's hierarchy of needs and how it's something that people need in order to have a healthy lifestyle. And so when you're on the floor and you're assisting the resident to sleep, make sure they're comfortable, make sure that the environment is conducive to sleep, so limiting your noise, maybe turning off some of the lights and just lighting up maybe their path to the bathroom. Just being aware of the resident's need to sleep and to be restful. And then for pain, we obviously learned how to assess pain. Most residents will use that numeric rating scale, which is the 0 to 10 scale, where 0 is no pain and 10 is the worst pain imaginable. So be aware of how to use that scale with residents who are cognitively intact. When you have residents who are cognitively impaired, you may need to look at an alternative option in terms of assessing their pain. There's lots of pain scales out there that are available for nonverbal pain assessment, where you look at maybe some of their nonverbal behavior. So maybe they're having some facial grimacing or some frowning, or they're crying, or their body movements are tense, or they try to guard or push you away when you touch an area that hurts. So pay attention to their nonverbal communication as well as their verbal communication with regards to pain. So Chapter 7, it's very straightforward. It does talk about some non-pharmacological measures that the CNA can do to alleviate pain. And this includes massage, maybe offering them a warm bath. Anytime that you use a hot or cold pack, you need to touch base with your charge nurse first, because a lot of times it does require a physician's order to use cold or heat in certain instances. And then you can also maybe do some guided imagery. Guided imagery is where you would have the resident kind of close their eyes, and then you'd kind of walk them through a more soothing scenario, if you will. And you say, imagine that you're on a beach and you can feel the wind blow and you can feel the sun beaming down on you. So you walk the resident through this guided image that maybe is a little more pleasant than what they are currently experiencing. So on the floor, be aware of verbal and nonverbal complaints of pain, and then think about the non-pharmacological things that you can do as a CNA to help alleviate some of their pain.